and we're really excited about tonight, and let folks get logged in, and we'll get started right at 7:00 p.m. on the dot. So I'm going to give everybody just another 30 seconds to a minute to get logged in. Welcome everybody who is logging in. Welcome. Hope you're having a good evening. We'll get started in just a minute. We've got a few people, we got 5 people already watching, so that's great. All right, it's 7:00. Welcome to the SCEA's live stream here. We're going to be talking about how to keep schools safe. My name is Todd Scholl. I'm a professional practice and policy teaching fellow with the South Carolina Education Association. And I'm so excited to be here tonight to talk with you and have this conversation, a really important conversation about how we can keep our schools safe, how we can keep our students and our educators and our support staff safe in schools here, public schools here in South Carolina. I want to welcome to the live stream 2 guests tonight. And they've been so gracious to come on and share their expertise with us and their time. Dr. Deborah Greenhouse is a member of the American Academy of Pediatrics Committee on Federal Government Affairs. She is the past president of the South Carolina chapter of the American Academy of Pediatrics. And Dr. Bob Saul is a professor of pediatrics emeritus at Prisma Health Children's Hospital in the Upstate. And he is the president of the South Carolina chapter of the American Academy of Pediatrics. I just want to welcome you both. Thank you so much for being here tonight.
Thank you.
Thank you for having us.
And, you know, I've got 3 kids. They've all seen their pediatrician many, many times. And anytime I have an issue or a question, I always go to my pediatrician because he is the expert. And what he tells me to do in terms of vaccine, in terms of masking, what he tells me to do in terms of procedures, and you know, if they're sick, what medicines they should take, I listen to him because he's the expert and he's studied. And I feel like we need to have this conversation because a lot of people, everybody has a right to study and to learn things and to make decisions. But I think we've kind of lost sight of the importance of listening to people who have expertise like yourselves. And a lot of misinformation has been being spread throughout South Carolina and really across the country about COVID-19, about the vaccine, about masking. What I would start off asking you is, what do you think what would be one of the biggest misconceptions or pieces of disinformation that you would like to clear up tonight? And we'll start with Dr. Greenhouse.
I would say probably the biggest piece of misinformation would be that COVID is not a significant illness for children. That I think a lot of the trouble that we've gotten into this year is based upon the fact that so many people promoted this idea that COVID is not a big deal for children. So they thought we could go into this school year not taking the precautions that we needed to put in place to make school a safe place for our kids. And it didn't end well. People went into it saying, okay, this doesn't really matter. Kids don't get sick from COVID. It's not a big deal for them. So we don't need the masks. We don't need to worry about the vaccines. We don't need to worry about distancing. And our schools went back and they basically fell apart. So if there is one piece of misinformation that I think started the whole ball rolling and led to a lot of the trouble that we had, it would be that COVID is not a big deal for kids, because it very definitely is.
Thank you. Dr. Saul?
And to put a finer point on that, if we look at some of the numbers nationwide, at the height of the surge in the winter, nationwide, there were 211,000 cases per week. Several weeks ago, there were 254,000 cases per week. This last week, it's down to 174,000, but we're up to where we were last January. So obviously, this Delta variant has been a game changer in that. And South Carolina, unfortunately, ranks second for the worst rate for children in the country, right behind Tennessee. And we also rank, unfortunately, very high in terms of deaths per million. Children, as Dr. Greenhouse said, children can get very sick. There are currently children in the hospital with this, currently children in intensive care, currently children on the ventilator, and currently children on a very invasive technique called ECMO, where you're replacing their blood with oxygen and carbon dioxide. I mean, so the numbers are small, but real. And why would we take that chance exposing our children for a preventable disease?
Thank you both for that. It's really frustrating, I think, for those of us who have been looking at the facts and looking at the information and the data that you're sharing, and to hear folks just sort of be dismissive of it, or to think of it as like there's some conspiracy to control people. What would you say to the people? There are people that I hear of that they're saying, well, parents should have a choice, and this is just the government trying to control our lives and take over. And how would you respond to those folks? Is there an effective way to overcome that kind of mentality, Dr. Greenhouse?
I'm not sure that there is truly an effective way to overcome that mentality for some folks, but there is a group where just logic and common sense can get past that. And I think the logic and common sense would say, yes, personal freedom is very important, and we should all have our personal freedom. But my personal freedom ends when it impacts someone else's health and safety. And that's what happened in our schools, that parents, if given the right to decide whether their child wears a mask, they impact the health and safety of someone else's child, and they impact that parent's personal freedom, and they impact the ability of that other parent whose child may be immunosuppressed, may be vulnerable. They impact the ability of that child to even be able to that parent to be able to send their child to school. So my point there would be that my personal freedom ends when it impacts someone else. And I think that argument works for some folks, does not work for everyone.
Thank you. Dr. Saul?
I mean, this is, we've been doing this for a long time. We did it with polio. We do it for other vaccines, for measles, for chickenpox. We recognize the risk to other people. So to do that, we put in place that we want everyone vaccinated when we can. And since so many people can't get vaccinated yet, our children 5 to 11, and unfortunately, the children 12 to 20 have the lowest vaccination rate. So until then, we want to protect our children with masks. I understand what people are saying. As Dr. Greenhouse said, the freedom is not freedom to cause other people harm. And to me, it's a misguided privilege that people are quoting. It's not a freedom. And you wouldn't, if you had a bad illness, you wouldn't or shouldn't go to school for other people. And since we don't know people can asymptomatically carry COVID, we certainly want to protect everybody until we get to where the public health officials say it's okay. We're not advocating for children to wear masks all the time. We want them to get rid of the masks as soon as anybody, but we also want them to be safe, and we want them in school. We know that school is so important.
Right. And you mentioned masks. Let's talk about that, because I see that on social media quite a bit, where people will say, well, masks don't even work. Can you push back a little bit on that and talk about the importance of why masks are important right now and their efficacy as well, Dr. Greenhouse?
Masks are a part of the layered protocol that we just need to put in place to have as many layers of safety as we possibly can. Masks are not the end all and be all. They will not prevent every case of COVID being transmitted. That won't happen. But they are a significant component of a whole protocol to keep our kids safe. There actually are studies that have been published now that have shown that places that are using masks have a lower level of transmission. Within South Carolina, quite frankly, we can look at our own school districts and look at the school districts that have been using masks along with other policies from the beginning of the school year, and look at the transmission in those districts versus the districts that haven't. And the difference is absolutely obvious. But more importantly, I would also say that the whole concept of masks has been completely politicized. I have kids come into my office every day complaining of everything under the sun during the pandemic. I mean, the kids have really struggled. What have I never heard a child come into my office complaining about? Wearing a mask. Not one, not ever. They don't care about the masks. They want to be in school. They want to be with their friends. They want to be learning in person. They're fine wearing a mask. This is an adult thing. Quite frankly, in my book, this is a made up problem. It's not a problem for the kids. We shouldn't create it and make it one.
Thank you. Dr. Saul?
Yeah, I would agree. I mean, the studies are quite clear now and have been coming up. The CDC just published 2 studies last week about the masks decreasing the transmission. But as Dr. Greenhouse said, it's part of the whole layered trend. What we need to do, we need kids to be washing their hands. We need kids to be separate as they can be, wearing masks and getting as many people vaccinated as we can. And that includes the teachers and staff and other folks that the children are exposed to when they're in the school setting.
Thank you. I was another key component, obviously, is the vaccine. Is, as you mentioned, getting folks vaccinated. We've seen over the past, I don't know, 20 to 30 years. You probably have seen this in your practice. More and more folks that seem to be have this sort of conspiratorial mindset over vaccines, but it's interesting that we do have a vaccine mandate. Like, you can't just send your kid to school. They have to have their vaccine record. So we already have a mandate in place with vaccines. When it comes to this particular vaccine, the COVID vaccine, I think maybe because, excuse me if I'm using the wrong terminology, but maybe because it has a different mechanism of action using mRNA than maybe other vaccines that we're used to. Maybe that's creating some of the doubt, but I feel like there's been this growing doubt about the safety of vaccines for a couple of decades now. Can you talk about the safety of vaccines and sort of dispel some of that misinformation about its safety, and then maybe outline the difference between what mRNA technology is and how it is safe, even though it's different than maybe what we've been used to in terms of vaccines, Dr. Greenhouse?
So the mRNA technology really has been used for quite some time now. They've looked at an Ebola vaccine. They've looked at several different vaccines using the mRNA technology. It is different. It works in a completely different fashion, but the idea is simply that messenger RNA is causing the body to say, okay, here's some messenger RNA, here's some information that I can use to make a part of the spike protein, just a part of the spike protein, not the whole virus, not even the whole spike protein. But my cells are going to make this big part of the spike protein, and then that messenger RNA is destroyed. It's gone. It's not there anymore. That little piece of the spike protein triggers my immune system to say, that's interesting. Now I've seen that. If I see it again as part of the whole virus, I'm going to mount an immune response. I mean, that's how it works. Very simple. Whereas with other vaccines, you may have actually given them part of that spike protein. They didn't have to make it. It was already there. So basically, it's just a different stage of the same process. But the messenger RNA vaccines, they've been looking at them for a long time. The studies that were done with adults were done using lots of people. I believe about 44,000 were in the initial adult trials. These vaccines are safe. These vaccines are very effective. You're 100% correct that there has been increasing distrust of vaccines that preceded the pandemic. If you look back to when the HPV vaccine, human papillomavirus, when that was introduced, it was incredibly difficult to pick up uptake, and we're still not where we need to be with that vaccine. In the state of South Carolina, we had a very difficult time getting permission to use state funding for kids whose insurance didn't cover that vaccine. And one of the myths that went around was that if you give kids the HPV vaccine, one, that it would make them sexually active, and two, that it could cause infertility. Well, interestingly, when the COVID vaccine was introduced, suddenly that infertility myth popped right back up again without any science behind it, without any theoretical basis of how it would even happen, but exactly the same anti-vax misinformation that was used for the HPV vaccine to sow distrust, they came right back and they used exactly that same misinformation to sow distrust for the COVID vaccine. But it is exactly that. It's misinformation. There is no data to support any of that at all.
Dr. Saul.
Well, I mean, I'm the oldest person on this call, I suspect. So I can go back to when, in my early days of training, several of the illnesses that the young doctors don't see now, I saw, but those have been eliminated because of vaccines. So vaccines are one of the greatest triumphs in my medical career. And we need to raise that flag to the top of the flagpole and salute it as best we can, because we need to understand it. Are vaccines perfect? No. You will have oftentimes we'll have some side effects. And some of the earlier vaccines had more significant side effects until they worked that out. But most of the side effects that occur to vaccines occur within the first 6 weeks. This COVID vaccine now has been with us for a long time. Hundreds of millions of people have been vaccinated, and we know its track record. Getting back also to some of the anti-vax movement, I think unfortunately occurred because of, and I can't remember now, I think it was in the 1980s when there was a study that said measles caused autism. Now that has been completely debunked, but that myth is still out there, floating around in the ether, and that unfortunately helps feed this other disinformation that gets out there.
Absolutely. And it's frustrating to see vaccines get demonized like that, when in fact, like you said, they're a triumph of science and medicine, and have prevented so much illness and suffering. For them to get demonized like this is just, it's bizarre. And I'm sure as pediatricians, it's got to be incredibly frustrating for you.
I'd hate to think we were having this debate in the 1950s when polio vaccine came out. We'd still have polio in the United States,
right?
If following our current trend,
right. And you would think in 2021 we would be able to progress and have a more nuanced and intelligent conversation about vaccines, but instead the disinformation seems to be more amplified, because now people with the disinformation also have social media outlets and have, are able to get that message out there through the internet, and it spreads like wildfire. It spreads like a virus. And I'm not sure how we overcome that other than having conversations like this one. You are two pediatricians with no political agenda that you're not trying to get a particular person elected through this information. There's no, George Soros didn't fund this conversation. We're not, this is just factual scientific information that you're sharing to try to save lives and to spare people illness and to help get us through this pandemic. Let's talk a little bit about how the efficacy of the COVID-19 vaccine, because I know a lot of people are saying, well, people are still getting sick with it, so why bother getting it, or it doesn't matter. But we're seeing very different outcomes in general for people who have been vaccinated versus unvaccinated. So let's start with Dr. Saul this time. Talk a little bit about how beneficial the vaccine is in terms of your outcomes if you were to get COVID.
Well, I think this current Delta variant surge has shown very well that the vaccine is very protective. It's not 100%, but it's very protective. And if you get sick, you're much less likely to be seriously ill, much less likely to be hospitalized or seriously ill. Now, there have been cases where people have gotten seriously ill and died even being vaccinated. That's always going to happen, but those numbers are very, very small. And if you look at the flu vaccine, which is very similar, some people say, "Oh, I'm not going to get the flu vaccine. It doesn't work. I hear it's 50-60% effective." But what they don't hear is it's 90+% effective for keeping you out of the hospital or dying from the flu. Same thing with COVID. That's why you need to get it.
Dr. Greenhouse.
So certainly I would absolutely second all of that. And I would say all you need to do is look at the numbers being released from our hospitals, both the adult hospitals and the children's hospitals. to see the impact of the vaccine there. The vast, vast, vast majority of folks in the hospital are unvaccinated. Frequently, 95% or more are unvaccinated. And that has also been the case in our children's hospitals. Obviously, some of the children in the hospital are too young to be vaccinated, but on a typical day, at least half of them are old enough, but none of them, literally zero, are actually vaccinated. So you can see that impact. And unfortunately, a lot of the initial early breakthrough cases that we're seeing were in physicians, because obviously they're continuing to be exposed over and over and over. And I know, unfortunately, a bunch of folks that have had breakthrough COVID at this point, they haven't gotten very sick. So yes, they did get the illness, but the lack of severity in my book is absolute proof that the vaccine does work. I can also say on the other end of the spectrum, my husband is a geriatrician. He treats elderly folks in nursing homes. And certainly he has had some breakthrough cases among the patients in his nursing homes. And again, the vast majority of them, and these are elderly folks, most with significant health problems, the majority of them have done fine with breakthrough cases. So I think it depends on how you spin it. You could take that information, and I've had multiple parents in my office do this, and you could say, well, people are still getting it. There's no reason to get that vaccine. Or you could look at it the way I would choose to look at it and say, sure, it's not 100%. Some people are still getting it. They're not getting very sick. That's proof that the vaccine actually works very, very well.
One of the things that I see people talking about is, well, I have a choice, it's my body, and I can choose whether I put a vaccine in it. And they think that they're not affecting other people by declining that. But what we're seeing is, because there's so many people that are refusing to get vaccinated, what it's allowing to do, and you correct me if I'm wrong on the science, is it's allowing variants to continue to thrive. And as long as those variants, like the Delta variant, continues to thrive, then there will be future variants. And as those variants develop, there's the potential there for them to eventually make the vaccines less effective, or to maybe be more severe, more contagious, like the Delta variant one is. So could you talk about why it's almost like a social responsibility to me to get vaccinated, to help squash this pandemic, and the danger if enough of us don't do that, what potentially could happen with variants down the road? And we'll start with Dr. Saul.
Oh, I would absolutely agree. I mean, I think it is a social responsibility. We've stopped allowing, in most circumstances, smoking in public, because we now know it not only affects the smoker, but it also affects the people that are exposed to the smoke. And so that secondary effect, the same thing can arguably be applied here. We want a primary effect to protect the people, but if other people are out there carrying the virus, passing the virus around, they're equally harmful to the population. And I just don't understand why we don't have this communal sense of responsibility to take care of each other in this circumstance.
Right. Dr. Greenhouse.
Again, I would totally agree with that. I think one thing that we need to realize too, and this is kind of unfortunate, is that the person who is refusing the vaccine for themselves, the person who is refusing vaccine for their child who's 12 or older, is frequently going to be the same person who's not willing to wear a mask. So it's that person that's out in the community, in a store, in a restaurant, unvaccinated, not wearing a mask. That is the person who is most likely to spread the illness. So yes, it is those folks out in the community who are going to be the ones that are going to allow for the emergence of more variant strains. And not all of those strains are going to take hold. I mean, you have to have just the right genetic makeup to be able to go and really take hold, like the Delta variant has done. There was another variant that popped up fairly recently called the Mu variant. And for various reasons, it does not look like that one really has taken hold, at least not in South Carolina. But that's not to say that the next variant won't just suddenly get out there and be just as efficient as Delta. and cause all kinds of problems. And what scares me the most, and literally just sends chills up my spine, is that this next variant may find a way to elude the vaccine.
Right.
Then we're literally back at square one or even worse.
Yeah.
If I could just add quickly, I think one of the important things to remember here is that it will be so important to everyone to get protected as we go forward, because if we're not, then it's going to be a problem. A lot of people say, "Oh, I'm healthy, I don't have to worry." To be honest, that's a bunch of hogwash. Anybody can get this. And then they say, "Oh, the people that got it were those that had underlying conditions." Yes, that put them at greater risk, but why should they be put at greater risk? We want everyone to be protected.
Our state leaders, to me, should be listening, bringing you in and listening to you. And I think some are. Unfortunately, too many are not, and they're playing a political game, I think, with this. If I were in charge and I could wave a magic wand, I would ask you, what do we need to do in terms of our public schools? What policies need to be in place now to make our schools as safe as possible? So that'll be sort of like our last question here, but what would be, if you could direct policy for public schools across South Carolina, how would you change the course of where we are right now? We'll start with Dr. Greenhouse.
So in my perfect world that I don't live in, if I could do whatever I wanted to do or needed to do in our schools, and quite frankly, I live in Richland District too. So, and I have a great relationship. I've been on their health advisory council since before I had children. So I've actually been able to help them get a lot of these things in place. But in my perfect world, I would have a mask mandate in the public schools for every child above 2 years of age, every teacher, every staff member. In my perfect world, everyone 12 and over who's eligible to receive the vaccine would receive the vaccine. The kids, everybody would spend as much time outdoors as they possibly could, so that we'd be able to distance as much as we possibly could. They'd have good hand hygiene. They'd have soap everywhere that they needed to have soap, which I think is a thing that isn't necessarily always there either. And we'd have a very robust system of being able to test the kids in the schools if we needed to, outside of the schools if we need to. We'd be able to trace. We'd be able to contact trace. We'd be able to get the kids out and isolated and quarantine the folks who need to be quarantined. And if we did all of those things, we really could minimize spread. But that said, I also totally understand that being able to do that requires funding, and being able to do that requires staffing, and being able to do that requires the cooperation and support of the folks at the top in the state. And right now, we don't have any of those things. We don't have support from the folks that actually are in control on a state level. We don't have the funding that we need for the schools to do these things. We don't have the staffing that we need for the schools to do these things. But that's my perfect world, and I would love to live in it.
That sounds like a great one, a great world. Dr. Saul?
Well, I don't know that I can improve her utopia other than to say, I want teachers and educators to teach and educate. I don't want them to be public health officials. I want public health officials. I want the teachers and educators to follow the advice of the public health officials. Currently, DHEC has said they recommend everyone that's indoors, and especially in a high-risk setting, which is what schools are, should have masks. We should be following the advice of our public health officials. And not the advice of politicians who I think have misguided views about this. We should never politicize public health. We should follow the advice of our public health officials. So if we follow the advice of our public health officials, we'll lead into Dr. Greenhouse's utopia.
Absolutely. I agree with both 100%. Thank you so much for your expertise tonight. We could continue talking for a while, but I do want to honor the time. I said we'd finish up at 7:30. and there are folks who are watching this and some who will watch later, and we would invite you to come onto our Facebook page and continue dialogue with them if they have questions. One last real quick question. I have an 11-year-old daughter, and she won't turn 12 until January. What is the latest news on getting the vaccine coming out for 5 to 11-year-olds?
So right now, Pfizer has submitted their information to the FDA and requested approval for 5 to 11-year-olds. And the FDA has said that they will meet to discuss that, I believe, the last week in October.
Okay.
They will look at all of the data. They will look at it very closely, and they will make sure that it looks as though the vaccine is safe, that it is effective, and that Pfizer would be able to roll it out the way that it needs to be rolled out. The FDA will make their decision, and then it will be sent to the Advisory Committee on Immunizations with the CDC. They will look at all that information and make their decision. Then you actually get to the point where it can be rolled out. So hopefully, in our perfect world, again, in my utopia, hopefully we're looking at sometime in November, if all goes well. Like you said, your 11-year-old, she's not that far from being 12 anyway, but hopefully it would come before that. The dosing will be different for the younger kids. It will be 1/3 the dose of the older kid and adult dose. But the studies have shown thus far that the younger children mount just as robust an immune response to that lower dose as the adolescents and adults do to the higher dose.
Okay, great. That's great information. Again, thank you both, Dr. Saul, Dr. Greenhouse, for your time. Thank you for what you do for our state, for the children of this state. Thank you for speaking the truth, for sharing science-based, factual information with folks who are tuning in tonight. Thank you very much for what you do and for advocating for our students and our teachers. And for those who are tuning in, if you are interested in joining the movement to deliver the schools that our South Carolina students deserve, you can head on over to our website at the SCEA.org. That's the SCEA.org. We invite you to learn more about our association. And if you are an educator or support staff member, we invite you to join us. So thanks again so much for Dr. Saul, Dr. Greenhouse.
Thank you.
Thanks to those of you tuning in, and we'll be monitoring the comments, do our best to provide anyone with questions or pushback with factual responses and comments. Again, thank you.
Thank you for having us.
Thank you.